Hello everybody. In this video we'll be discussing muscles of mastication. Firstly we'll be discussing the origin and the insertion of the muscle. So first masseter. Originates from zygomatic bone. The maxillary process of the zygomatic bone is the zygomatic arch. So basically the masseter is originating from the cheekbone and it is getting inserted on the angle of mandible and lateral surface of mandibular ramus. Okay, on the lateral surface it will get inserted. Then is temporalis. Temporalis is from temporal fossa and temporal fascia and it is inserted into coronoid process. Then we have medial pterygoid. Medial pterygoid is from the medial surface of lateral plate of pterygoid bone. The deep head is from the pterygoid, okay, sphenoid bone, that is from the pterygoid plate, a medial surface of the lateral plate of the pterygoid. And then superficial head is from the maxillary tuberosity and the pyramidal process of the palatine bone. So deep head is from the sphenoid bone and the superficial head is from the palatine bone and it is inserted in the medial surface of ramus and angle of mandible. On the lateral surface we had the masseter. On the medial surface we have the medial pterygoid inserted. Then lateral pterygoid. Lateral pterygoid is also originating from the sphenoid bone, but it is inserted on temporomandibular joint. So now let's see from the image the origin and the insertions. So here we have the image. See, first we discussed masseter. Masseter is coming from the zygomatic bone and getting inserted on the lateral surface of angle and the ramus. Then we have the medial pterygoid. Medial pterygoid, deep head and superficial. Deep is coming from sphenoid and superficial is coming from palatine bone, and these are inserted on the medial surface of the angle of the mandible. See, like here master is inserted on the inner side, the medial pterygoid will be inserted. Then we had temporalis. Temporalis is coming from temporal fascia and temporal fossa and inserted on the coronoid process. The front one process is called coronoid process and inserted on the coronoid process we have the temporalis. Then lateral pterygoid. This is coming from sphenoid and getting inserted into temporomandibular joint. See this back process. This forms the temporomandibular joint. So here lateral pterygoid, here temporalis, and medially medial pterygoid, and laterally masseter will get inserted. Then next we see the movements by the muscles. Okay, opening and protraction. Opening will be by the lateral pterygoid. Then closing will be by the masseter. And closing and retraction. Retraction R is coming, so temporalis. Temporalis will do closing and retraction. If only closing is there, then masseter. And cheek inflation is due to buccinator. And then protrusion and side to side. Protrusion and side to side movement of the jaw is by pterygoids, medial and lateral pterygoid. Retraction we already discussed, closing and retraction by temporalis. Then we see depression and elevation. Depression means opening the mouth. Opening the mouth is by lateral pterygoid. And along with that, which muscles we have? Digastric, geniohyoid, mylohyoid. That all three muscles and the lateral pterygoid that will help in the depression of the jaw or the opening of the mouth. And in the elevation only closing masseter and the temporalis, that is closing and retraction, that one, and one medial pterygoid is involved. So opening lateral pterygoid, digastric, geniohyoid, mylohyoid, closing masseter, plus retraction temporalis, plus medial pterygoid, side to side movement medial and lateral pterygoid, inflation buccinator. That is all we need to remember about the movements. Now let's see the images. First, this image we see here. See from the above here, this muscle coming and inserting is, this muscle is the our temporalis. Temporalis is coming from above and getting inserted. So this is temporalis. Then we have the lateral pterygoid. Lateral pterygoid going toward the temporomandibular joint. Then medial pterygoid going toward the medial surface of the mandible. And then we have the masseter muscle. Masseter muscle on the outer side. So this is masseter, this is temporalis, this is lateral pterygoid, and this is medial pterygoid. If we remember the origin and insertion, then we can easily identify from the images which muscle is marked. Then next we see this image. See here, this image is at the level of the sphenoid sinus or the sphenoid bone. So at the level of the sphenoid bone, we will have both the medial and the lateral pterygoid. The one which is lying medially will be medial pterygoid. The one which is lying laterally will be lateral pterygoid. And the masseter on the outer side and the temporalis in relation to the mandible. Say four muscles are there in the image and the image or the section is at the level of sphenoid. Then from medial to lateral, we will have medial pterygoid, lateral pterygoid, temporalis, and masseter. Now let's see another image. This image. Here we have only three muscles. So here the outer one is masseter, and then we have the lateral pterygoid, masseter and temporalis, as there were in the previous image. That is similar. Masseter and temporalis. Okay, but here lateral pterygoid is only visible in relation to the mandible condyle. Okay, mandibular condyle is there in the image, and to the condyle, which muscle is inserted? Lateral pterygoid. The medial pterygoid is not visible in this image. If the condyle is there, then three muscles will be there, and if the sphenoid bone is visible in the image, then four muscles will be there. So that is all what we need to remember in relation to muscles of mastication. I hope it will be simple for you now. If you like my content, please do subscribe my channel. Thank you.